Hello everyone. Last week I did a video on vomiting which went down really well, so I thought I'd do one this week on coughing. We see a lot of coughing, especially at this time of year, and coughing is often seen to be a diagnosis of a problem, and it's not. It's generally a sign of a problem underneath. So what sort of thing causes coughing? So a cough, typically, if you think about it, it's an irritation in the chest, which causes that fast expulsion of air. And when we think of coughs, I suppose we always think about Veno's or Benylin. We think of dry, tickly coughs, or we think of those sort of deep, more productive type coughs. Of course, this kind of cough is caused by just one thing, which is an irritation within the airway. Now, if we remember what we've got coming down from our in our chest, we've got our trachea, our windpipe coming down, and it splits into two at something called the carina here, and the heart is on this is my left side, I should point out. And there are various sort of lymph nodes, and there's your food tube, your esophagus running down here as well. So there are various structures all around this sort of area. If they get irritated, they can cause a cough. So when someone brings an animal into me that has got a cough, the first thing I've got to ask is, what's causing it? I don't want to just short circuit and say it's an infection, a viral, bacterial, whatever it might be. So let's think about the structures in turn. We've got the windpipe that's coming down there. That could get irritated. What could cause the irritation within the windpipe? Yes, viruses definitely can. Bacterial problems can cause issues in the windpipe. And of course, viruses, bacteria, we commonly think of kennel cough. Kennel cough is actually an amalgamation of three different causative factors: parvovirus, adenovirus, and Bordetella bronchoseptica. So you've got two viruses. Bordetella bronchoseptica is a bacterial problem. Bordetella pertussis is what causes whooping cough in children, interestingly enough. Bordetella isn't transmissible between humans and dogs. So we've got viruses, we've got bacteria causing irritation within the trachea, the windpipe. Worms, parasites, very rarely seen, but some kind of parasite in there might cause issues. Perhaps the parasites are also causing bleeding, any sort of blood floating around in the windpipe. Typically thinking of lungworm at this point might be causing irritation, which is causing the cough. There might be an abnormal production of sputum within the lungs and within the windpipe. This commonly as a result of perhaps a condition like Westy lung, fibrosis within the chest. Polyps or other growths can cause problems within the windpipe as well. Or indeed foreign bodies, something's been inhaled, a grass seed or a blade of grass or something like that is down there and it's tickling and it's causing irritation. So that's the windpipe. What else could be causing problems? Well, there could be problems within the lungs, which in and of themselves don't necessarily cause a cough, but what's being produced within the lungs is coming up into the windpipe and causing the cough. So perhaps bleeding, pus, sputum, those sort of things coming up into the windpipe. So that's the sort of airway system. What else could be causing that cough? Well, we did talk about lymph nodes. We've got something called the mediastinum, which is sort of the membranes between the lungs that encase the heart, and lymph nodes and all that sort of thing. And we often talk about mediastinal masses, so growths within that mediastinum, which are causing issues. And generally they push onto the trachea and they cause irritation in the trachea. So mediastinal masses, we could be thinking about cancers, growths in there, or you can have sort of thymomas, enlargements of various glands and things, or indeed anything that causes any kind of enlargement or swelling within the mediastinum. The second big category of things that cause cough are cardiac complaints. When something goes wrong with the heart, because of various sort of pressure differentials within the heart, we can see enlargement of the heart, and enlargement of different parts of the heart, or indeed the whole heart, can cause pressure onto this carina, this splitting of where the windpipe comes down and splits into the two lungs. So if you think about valvular failure in dogs, that often causes enlargement of a part of the heart called the atrium, which is the preloading chambers. These atriums then bulge up and they push onto the trachea, and that can cause irritation and coughing. So coughing can be the first sign of cardiac problems. We can also see back pressure as well into the lungs. So if we think of people with cardiac problems, they often have fat ankles or that sort of thing. That's due to a buildup of fluid within the ankles. We can also see that within the lungs, and we call that edema. And edema within the lungs has a certain propensity to cause a cough. So what can we do about coughs? Well, we look to stop the underlying cause, treat the underlying cause of the cough. But occasionally we want to give something called antitussives, which is like a Benylin or a Veno's type thing, something that soothes the cough, basically reduces that reflexive, expulsive effort from the body. And the various different types of antitussive. But what I would always advise is not to give an antitussive without identifying what the underlying problem is. For instance, if we give an antitussive, something that stops the cough, but actually there's a cardiac problem behind there, or perhaps there's an infection behind there, and the cough is actually an important way of getting that foreign material out of the lungs, then we could actually be doing more harm than good. So really, really important. It can be really tricky as well, because sometimes when we look at a coughing animal and we start to wonder, is this a lung or windpipe mediastinal problem, or are we dealing with a cardiac issue? If it's a mild, soft cough, there may not be a lot of pus, there might not be an awful lot of lymph node enlargement, or we might not see cardiac problems, we might not see a variation in the heart rate or heart rhythm. We might have to do further diagnostics, and one of the best things that we can do in that case is an x-ray. But other things that we can do are things like putting a camera down there to have a look. Sometimes putting a needle into the chest can help to sample things, or flushing a little bit of fluid down there and swabbing out exactly what's all the sputum or pus or bacteria or virus or whatever it might be down there that might be causing it. So coughing, more complicated than you might think. Thanks for listening. Bye.